Um, so, where was I? 80% odds, yeah. Our work isn't done, right? Your work isn't done just because we've hit that 80% mark or that 90% mark, because that still means there's a 1 in 10 or 1 in 5 chance that your child is not going to walk out of that hospital. And that, when you think about it from a loss perspective as opposed to a gain perspective, which is what you do as a parent, it's hard. It's hard to roll that. It's hard to roll that dice. Roll those dice. Sorry. We did. Thank God. Zach made it through. He made it through smoothly. He's happy and healthy. He doesn't like the fact that he still has to get blood draws every 3 months, but we'll pay that price because that's what helped diagnose him in the first place. But your work isn't done just because we're there. We can't rest on our laurels because too many parents still have to make that hard choice, and too many of our friends in the rare disease community don't have the success that Zach did, and we still live with a little bit of guilt that Zach is happy and healthy when other parents didn't make it. So if there's a takeaway there, it's that 80% sounds great, it's not good enough. Pause before I look at my notes here. I don't think you should dangle from that. Okay. I learned that one from Kevin Nealon. So, speaking of, what Zach's experienced through this, one of the things is that Marissa and I grapple with is what to tell him. We go to Camp Sunshine up in Maine 1 week a year. It's one of those camps where every week is dedicated to another life-shortening or fatal illness, and so they have a Fanconi Anemia week. And we explained it to him when we first went. He was 7 years old, as it's a camp for kids who have to go to the doctor a lot. And he's still, to this day, he knows what the word, he knows that there's a thing called Fanconi Anemia. He knows he goes to the doctor a lot. He doesn't know what it means, because how do you tell even an 8-year-old that he's got this life-shortening illness? Why would you torture a child like that? Some people tell their kids, some people don't. I torture myself all the time because there is no right answer there, and we've made our choice. We'll wait until he starts asking about it, and then we'll tell him as soon as he does, but he hasn't asked yet. But that's just one of the things. How do you tell a child? When is the right age to tell a child that they have this life-shortening illness? So in the meantime, we try to treat him normally. You saw one of the pictures there. We got him on his first snowboard just a week ago. And like I said, he has this 15, 20-year runway that, thank God, the bone marrow transplant was able to give him. And we try to actively fundraise for the Fanconi Anemia Research Foundation and Sloan Kettering and other research and treatment organizations that are out there looking for better bone marrow transplant protocols, increase those success rates, or research into gene therapy, immunotherapy, anything other than injecting poison into your child to try to cure them of cancer.